Happy Valentine's Day to you all. I know that a lot of you are in the mood to party, but remember, whatever you do, moderation is key. So I want to talk to you guys today about peptic ulcer disease, because it's common amongst men and women today. Even some youths are beginning to experience that. So when you hear the word peptic, it simply means that the cause of the problem is acid. And ulcer occurs when the stomach acid damages the lining of the digestive tract, which can either occur in the esophagus, in the stomach, or in the upper part of the small intestine known as the duodenum. Peptic ulcer can either be called gastric ulcer or stomach ulcer. Now there are two major types of peptic ulcer: the gastric ulcer or the duodenal ulcer. In my next video, I'm going to bring you a detailed explanation of the difference between the gastric ulcer and the duodenal ulcer. And now there's a major cause of ulcer, which is an exposure to a bacterium called the Helicobacter pylori, as well as the overuse of the non-steroidal anti-inflammatory drugs. Now there are also some risks that can predispose you to having ulcer, one of which is chronic stress. The second one can be excessive use of alcohol or even smoking excessively, and then also eating of too much spicy food can also put you at risk. Don't get me wrong, I did not say there are causes, but they can put you at risk of having peptic ulcer. Most people with peptic ulcer can go asymptomatic. They don't even have symptoms at all, but a lot of people have the major symptom of a burning pain in the upper part of their stomach, called epigastric pain. And then some persons also may present with the symptom of weight loss and unexplained weight loss. And then for some persons, they may experience bloating. Majority of persons experience bloating though, and also food intolerance. When they eat some kind of food, they react to them. And then also for some persons in a chronic stage, if there's an erosion in the lining of your stomach, some persons might vomit blood called hematemesis, or they can pass stool that is stained with blood called melena. Now I want to encourage you that if you suspect, if you think or you are suspicious of the fact that you may be having the symptoms of peptic ulcer disease, I encourage you to see your doctor for a proper evaluation and treatment, as an ulcer that is left untreated can lead to a more serious medical complications like internal bleeding, can also cause stomach cancer, can cause perforation of the lining of your stomach, which can lead to inflammation of the peritoneum called peritonitis, and it can also cause you intestinal obstruction. Now, how do you prevent peptic ulcer disease? Helicobacter pylori is usually gotten by contact from persons to person, and also by consuming dirty water and eating food that is not properly cooked. So I encourage it is better and important that you imbibe the habit of a good personal hygiene. Wash your hands properly after use of toilet. When you go out and come home, wash your hands thoroughly. And secondly, be sure that your water is properly treated before you drink, either boiled or properly treated before you drink. And also ensure that your food is properly cooked, as well as the environment where you are cooking, make sure it's clean. Then secondly, try as much as possible to minimize your alcohol consumption, or even stay away from it completely. And thirdly, ensure that you stay away from tobacco smoking, please guys. And then the fourth one, also, if you are on non-steroidal anti-inflammatory drugs, make sure you take them with food, not in an empty stomach, because not taking them with food is going to expose your stomach lining to the content of these non-steroidal anti-inflammatory drugs that can erode the lining of your digestive tracts. Do enjoy your day, guys. Bye.